All right, when we're looking at the cat coming off of the aorta, the first branch off this large one is the brachiocephalic artery, okay? And then right here, this is the cat's left, so this is the left subclavian artery. Now, you're going to follow right here, and then you should have, and I think one of them is broken, but you should have a left and right common carotid artery. Right after that common carotid artery, right under here, this little tiny portion from here to the wall of the cat, that is the right subclavian artery, okay? The minute it goes out of the body wall, it is going to become the right axillary artery in the armpit, okay? And then when it hits the arm, and actually over in the arm, it's going to become the brachial. Okay, we're going to have to move down to this cat on the end. Okay, right here on the end, we have the ulnar artery and the ulnar vein, and this will be on the cat's right side. The vein is not dyed, but over here on the left side it is. So this is the left radial vein and artery, and then over here would be the left ulnar artery and vein. Okay, the ulnar is on the pinky side, and the radial artery and vein are on the thumb side. Okay, all right, back down here. Okay, then we're looking at veins. This is the superior vena cava. I'm trying to see the inferior vena cava. The inferior vena cava would be right here below the heart. Okay, there's the inferior vena cava, there's the superior vena cava. This is the mammillary vein, okay? This would be left and right brachiocephalic veins. Now, they're brachiocephalic until you get to here. And then this is going to divide, and this is going to be the right external jugular vein. This is the right internal jugular vein. It usually doesn't stain, and it usually blows out on most cats, okay? Then we're going to come right here, and so just this short piece, literally this long, from here to here, is the right subclavian vein, okay? And the right subclavian vein, when it comes out here, we have subscapular, and then axillary, and this would all be right subscapular and axillary veins. Hits the arm, it's brachial, and then like we looked at a while ago, you would have a vein over here, you would have the radial and ulnar, okay, and that would be on that right side of the arm, okay? That's the upper part of the cat. So now we're going to go below the diaphragm. Okay. All right. Below the diaphragm, if you look on the cat's right side, that is the best way to look at the hepatic portal system. Okay. So the hepatic portal vein is going to be stained yellow, and where it comes out of the liver, that's going to be the hepatic portal vein. There's a tiny branch off of it that runs through the pancreas up to the duodenum, and that is the anterior pancreatico-duodenal vein. You're going to come down just a little ways, and a pretty large vein coming off the bottom of that, that is going to be the gastrosplenic vein. That's the first big division off the hepatic portal vein, okay? We're going to follow that on down, and then this is going to divide. Right here we have a division. This is the inferior mesenteric vein. It comes down here to the large intestines, and it drains the large intestines. This large one that comes through and goes up higher, this is the superior mesenteric vein, and it drains the small intestines. Now we're going to back up just a little bit, and there should be, and if it hadn't gotten torn off, there should be a little bitty yellow vessel, and I can't tell if that's it or if it's gotten torn off. There should be a little yellow vessel right in this area coming, I don't see it, but it's comes up through here. It would be the posterior pancreatico-duodenal vein, okay? And then we're going to move to the celiac trunk, and it's on the cat's left side below the diaphragm, okay? All right. So a while ago, one of the things I didn't show you, and I'm going to mention here above the diaphragm, the aortic artery is on the cat's left side above the diaphragm, and I forgot to mention something else to you. You should have an azygos vein. I'm sorry, I'm going to have to move to another cat. Here we go. Let's show you on this cat. I forgot to mention this above the diaphragm. There's an azygous vein that comes off of right here where the superior vena cava is. That's the azygous vein, and it's going to be on the cat's right side. Okay, sorry about that. Okay, coming back below the diaphragm. Okay, if we come below the diaphragm, the aorta comes through the diaphragm. The first branch that's large coming off the aorta on the cat's left side, that is going to be the celiac trunk. The second large branch is going to be the superior mesenteric artery. Okay, the celiac trunk has several divisions. One of those divisions, if I follow it to its end, it's going to split and go out here to each end of the spleen, and so those will be two splenic arteries. If we back up, this is the bottom of the stomach that I'm touching. There's a splenic artery. There's one. Here is another splenic artery. And then really deep and quite a bit thicker than the splenics, this first division off the celiac trunk coming from the aorta, that is the hepatic artery. You'll notice the difference in the hepatic and gastric because the hepatic artery has a thicker diameter. Okay?
Those are the gastrics.
This one's...
The
Yep.
book instead of splenic.
Oh, did I say splenic? I meant gastric. Sorry. Thank you for correcting me. Those are gastric. I said splenic. Those are gastric. So those go to the stomach. Thank you. Okay. All right. Coming on down. Okay. We said superior mesenteric artery. This is the inferior mesenteric artery. Okay. That goes to the large intestines. I'm going to back up just a little bit. Right here is the adrenal gland. So coming across that is the adrenolumbar vein. And usually there's a tiny little artery with it. Sometimes it's underneath it. Let's see. Let me look right here at this. I'm seeing which kidney is up. Right here is a renal vein coming into the kidney. And on the underside, we should find a renal artery. And I'm going to look for that renal artery. Is there a good renal artery on one of these other ones that we know? Some of you who have a cat over here. Look over here. Okay, yep, here's a good one. Okay, here's the renal vein. Here's the renal artery. This is a really nice adrenolumbar vein, and actually coming all the way over here to the wall. Let's see if I can see the adrenolumbar artery. It may have torn. That may be part of it, like right there. I can't see because it's got some fat around it, but I think that's it right there. I'm really excited that here's a nice renal vein, and this would be the left renal vein, and you have to say like left adrenolumbar. I left that out, but it's because most of us did everything on the left, but you do need to identify left. I want to show this here. Sometimes a gonadal vein will come off of the inferior vena cava, which is here, and sometimes it comes off the renal vein. In this case, this is a female cat, and it's coming off right here and going over to an ovary, which would be over in here. So this would be an ovarian, this would be the left ovarian vein, and then this would be the left ovarian artery right in here coming with it, okay? As we move down, here's the aorta, the descending aorta. Here's the inferior vena cava. This would be the iliolumbar artery. The iliolumbar vein did not stain here, okay? But it would be right here. Now, I think, did we say that has a better leg? Okay, let's move down to this one because it had the best leg. Okay, this also has, this has perfect adrenal. This is this would be the left iliolumbar artery and vein right here, okay? Now, if I look at this part, this is the left external iliac artery. This is the left internal iliac artery. And then right here, this inferior vena cava divides into left and right common iliac veins. There is not a common iliac artery. So it's the common iliac vein here, and where it changes names, I'm going to try to push this over. Do you see where that iliac artery goes in, that left iliac artery? There's going to be a left internal iliac vein going down with that. We can look at it from here, or we can even look at it from the other side. I think it may be actually better on this cat from right here. Okay, so it's going to change names here, right at this part. So this is going to become internal and external left iliac veins, and we call it internal and this is external that I'm following until we get to this point. Right there is the left deep femoral artery and vein, and then we have left femoral artery and vein until you get to the knee. This would be left popliteal artery and vein and left saphenous artery and vein. I'm trying to think. Besides, I showed you the adrenal gland. A while ago when we looked at the hepatic portal system, right here attached to the first 4 inches of the small intestines, that's the pancreas. I could definitely ask you the pancreas. And then let's go up here and see if we've got thyroid glands. There's a thyroid gland. You'll have a thyroid gland on each side of the trachea. So I could ask you those. If somebody has a thymus gland, if you remember they laid across here, I may throw a thymus gland on there as well. Okay, also make sure you know ovaries. We don't have to know testes this time. At least on the cat.